Hi, I'm going to go over patient medical assessment and management procedures. So first, I'm going to take PPE precautions to make sure my scene is safe. And then I'm going to determine the nature of illness and how many patients I have. Then I'm going to request EMS backup if necessary and consider C-spine. I'm going to give a verbal impression of my patient, general impression. And then I'm going to check the responsiveness and level of consciousness. And then I'm going to determine the chief complaint and check if there's any apparent life threats. Then I'm going to check the airway and their breathing and give them oxygen at 15 liters per minute. After that, I'm going to check if there's any major bleeding, and I'm going to check their pulse, and I'm going to check their skin color, temperature, and condition. Then I'm going to make the patient a priority for transport, and then I'm going to do OPQRST. I'm going to ask what happened. Does anything make it feel better or worse? Can you describe the pain? Does the pain travel? On a scale of 1 to 10, how bad does it hurt? How long has this situation been occurring? Then I'm going to do sample and determine if they have any allergies, any over-the-counter medications, any past pertinent history, their last oral intake, and the events leading to the situation. Then I'm going to determine which body system was affected. And then I'm going to take their blood pressure, their pulse, and check their respiratory rate quality. And then I'm going to give a field impression. I'm going to describe the treatments and interventions. I'm going to describe how and when to reassess the patient, and I'm going to have a verbal report ready for when I get to the MS unit.